animated students. It does not bother me. I am an animated professor too, so it's no big deal for me. So, welcome to week 3. It's going by quick, okay? Really quick. Next week is your first exam. There are all sorts of reviews going on. There was one this morning already, and I didn't get that notification till right when I gave you that announcement. Be aware, there's one at 9 o'clock in the morning, and then I filled in the rest of the times for you. So you do have a study guide. It is pretty comprehensive. Remember, those study guides are not only good for your exams, they also are good for your HESIs. They're a good review when you go back and start studying for them. Okay, I've heard them useful. I know that I've been a big part of making these study guides, and I know that I take concepts from the HESI because all I get is concepts. I've never seen a HESI. I do not know questions. All I know is the topic, the concept. And so I tried to fill out questions for you and figure out what information they're looking for. And students have told me I'm pretty spot on, so I guess I'll keep guessing. So I'm a good guesser. So we are going to do our PowerPoint first, and then we're going to be doing a Kahoots, and we should be about quarter after on time to let you know, okay? So let's go ahead and let's start.
Um,
Remember, go ahead. Anybody has any questions, anytime, interrupt me, please.
okay, I'm sorry. So
That's
the
okay.
question that I have is, I noticed it was saying that we had to turn in our assessment.
No,
Um,
the topic.
I mean, that's some of the topic. Are we going to get the package?
It is in your modules on week 8. Now,
Okay.
I have that listed there. Not that you have to this week turn it in, but to start thinking about it so that in the next 2 weeks, 3 weeks, you're going to give it to me before it is, you don't give me at all. And then the topics will narrow down as students start giving them to me. So you don't have all ADHD, all autism, all diabetes, all asthma, all whatever, because that's what happened when I was not going back and making you tell me what the topics were. And again, pick something that's near and dear to you, something either you want to know about, or pick something your child, you, your sister, aunt, uncle, next door neighbor, best friend has somebody with something that you want to know more about. So you make it a learning experience, and then it's not going to feel like I'm pulling your fingernails out one by one. Okay? Because it can feel like that if you don't.
Professor, where do we submit those topics?
Just send me a message in Canvas. That's all I want.
Okay, thank you.
No, you're very welcome. Okay, week 3, school age and adolescents. So we've gone over infants, toddlers, preschoolers, and we've seen how they have grown so incredibly that first year of life. And it slows down, and how they start thinking, starting understanding, and then they're in school age. So now they're in school. We know that school age is ages 6 to 12. Great group of students, great group of kids to work with. It is the group that I did my dissertation on, school age children. School age children, attitude and behavior towards injections. And the 6-year-old, I'll have a different opinion than the 12-year-old. So it was a really great bunch of children to ask for. So we know all your baby teeth are in and they start falling out at age 6. Now, I'm still waiting for Christian's teeth to fall out. He had one that somehow he yanked out or were hit out on the bottom, but that wasn't the normal loose that you pull out type tooth. So I'm still waiting. And he'll be 7 in January. So again, he's slower than the normal, but again, that's okay. All kids are different. That's why I love them. So it starts out with all baby teeth, and you'll end up with all of your permanent teeth in. Not your wisdom teeth, but permanent teeth will be in there. Again, it is a slow stair step, gaining weight, getting taller, gaining weight, getting taller. That is part of what happens. And now we're starting to get more mature emotionally and physically. 6 years is a long time. So they can gain 1 to 2 feet in that 6 years, but let's break it down. It's 2 inches a year they grow in height and 2 to 3 kilograms a year. So about 4.5 to 6.5 pounds a year, which isn't a lot. But then look at that, your weight doubles in that school age period. And boys or girls are all the same until they hit that puberty, right? They go through puberty, then all of a sudden those boys are taller and girls are not the bigger ones anymore because usually that's what it's before then. We know movements get more graceful. They're not as awkward and clumsy. Their muscles are getting longer and strengthening. That baby fat is all going away and they're getting more muscle tissue now. Their head circumference has nothing to do with relationship with anything, and their faces start to grow up. Now, the one thing you have to be careful with school age children, and I have a 9-year-old, just turned 9 years old grandson. He's 9, he's 5 foot tall and 145 pounds. You would want to treat him like a teenager, but you have to remember he's only 9. So you have to look at the child's age. Don't look at what they look like because then you're not on their level. You're talking over them, okay? Don't treat them older than what they are. Treat them on their age. And it is that age for all I want for Christmas is my 2 front teeth, right? All those loose teeth. Everything gets more mature. They can hold their urine longer, and their heart is not as big in the chest. Now, an infant heart seems to take up that whole chest, right? But as they get older and bigger, that heart seems to be in more proportion there. We know because they've had many colds and, upper respiratories and diseases and germs and all that, their immune system is getting more and more effective. And of course, with their immunizations, their bones are getting more ossified. And again, physical maturity does not correlate with emotional and social maturity, which means treat them the age that they are, not what they look like. That prepubescent, they say it's 2 years before age 13, so somewhere between 10 and 11. That's that prepubescent where we start to see little changes. The first pubescent change in a girl, you'll see breast buds. That's usually about age 10. That's why at this age, boys are still a little dumb, right? Because girls are maturing, emotional, hormonal, all of that's starting to happen. I remember thinking this at that age. Boys are just dumb, you know? They just don't understand. They act like children or like a child. Because look at that. Puberty starts with girls earlier than boys, 2 years before. Now, when you're doing an assessment on a child, again, number one, you're not going to walk in and do anything. You're going to get below them. You're not going to tower on them. You're going to sit there and break it open the ice by talking about, wow, you've got curly, gorgeous hair. Or, oh, look at those eyelashes. Or, how you doing in school? Oh, you got A's and B's. Wow, you're amazing. Depending on the level of the kid. Now, some is good for 6 years old and some are good for 12-year-olds. So you got to figure out how to get on them. Now, a 6-year-old, their developmental level, explain it in the term of getting an x-ray. Now, an older kid probably understands what an x-ray is. A 6-year-old, especially a 6-year-old boy, might think of all superheroes and Iron Man and whatnot and think that an x-ray means x-ray coming out of the eyes and it's going to burn holes in you. You could think that way if you were a 6-year-old, right? So let's explain it so they're not going to run out of the room and down the hall and outside because I've seen kids do that. Okay, tell them what we're going to do is we're going to have a big camera. It's going to make noise. It's hanging from the ceiling and you're going to hear click, clicks and whatnot. It's not going to touch you. You're not going to feel it. And when we're done, it's a big camera, take a picture, and I'm going to show you, when you come back, the insides of your body. I think children understand that, especially if they've had fractures. They can see the fractures. They can understand it. I can show them a pneumonia, that consolidation. Or sometimes, what if they swallowed that quarter? Because foreign bodies are huge in children, and quarters is the coin that they swallow. Not pennies or dimes, quarters and it gets stuck right between the clavicles. Taking a picture and show it to them. And then they understand how and why we're going to get it out, right? So it is a learning process. We're going to listen to, auscultate, percuss, we're going to palpate. Lymph nodes in a well child, you shouldn't feel them, they shouldn't be there. It is the sick child. When you start feeling those little lymph nodes underneath the armpits there, in the groin, if you're feeling them, something's going on. Then you would inspect it. The kid's not healthy, something's happening. You shouldn't feel them otherwise. The hypoglossal nerve on a child. This is all about the tongue, right? Glossal is your tongue. So how do you assess that? Well, have you ever gone to a young little infant, start sticking your tongue out? They're going to imitate you about 3, 4 months old. They really do. And you just keep doing it, and all of a sudden you see the tongue try to stick out. It can be done at a very early age, believe it or not. Learning how to assess breath sounds. Children are different. You can put the stethoscope over the breath sounds and listen to them, but in children, there's all this upper airway mucus and congestion going on. So is it this that you're listening to that you think is rales and rhonchi below? Or is it really something going on in the lungs? So if we listen to bronchial breath sounds, which is in between the suprasternal notch, in between those two little clavicles there, we're going to take a listen. And I used to actually tell the students, put it on their neck, your stethoscope. And if you hear a bunch of noise, you're listening to referred sounds in the lungs. Very important to understand. Is it bronchial or is it really your lungs? Now, some of your theorists, I know the theorists, it's getting very confusing. I know that Erickson and Piaget are your two big ones. You're going to see a lot of them, not only in the exam, and Kohlberg is another one will be there, and Freud. Those are your 4. You're not only going to see them there, they're going to be on your HESI and your NCLEX. So it's something that should be reviewed. We know Freud has something to do with sex, whether it's anal, whether it is, just, intimacy. It's all about something to do with relationships. It's same-sex peers is something Freud says all about it. And now again, it starts with, saying, oh, I like that boy, right? You have a boyfriend when you're younger coming on, I know little Christian has a little girl, my next door neighbor, little Mia. He's going to marry her when he grows up. And they just little over the fence talk to each other, and occasionally we'll see them on a holiday, but briefly, and he's going to marry her. So it's again understanding boyfriend, girlfriend, and some of them are girlfriend, girlfriend, or boyfriend, boyfriend. And whatever it is, it's a relationship. Now, Erickson, one of the biggest tested items that you will see is school-age Erickson. So it is a sense of industry. Well, what does industry mean? Well, that's a task, something they do well. Now, I was good at spelling. I was good at math. I also was a great tap dancer. So I did that well and I got praise for it. And that was something that I felt good about. But I wasn't good at writing. And I felt, and what we say here is that inferiority. So it's industry, what I do well. It makes me feel good and makes other kids go, wow, she does that well. So it's peer approval there, okay? And then the inferiority is those things I can't do well. There are kids that are good at sports, not good at schoolwork. At school, they feel inferior, but in sports, they feel a sense of industry. Now, why do you need to know these things? Well, what if you have a school-age child and it's in the hospital and they're there for a long term because of whatever injury or whatever diagnosis? To have them sitting there in a hospital bed all day long or just in the room, they're going to be bored. So you need to give them tasks or something to do to occupy time instead of just watching TV all the day, right? Well, you need to give them something like, for instance, how about if I gave them a puzzle, 2,000 pieces, all the same design, and said, here, do it. They're not going to be able to do that. I can barely do that, right? That will give them a sense of inferiority. And you're trying to make them feel good, a sense of industry. So how about a 500-piece puzzle that doesn't have all the same designs, and give them the time and the place to get it done? When it's done, they're going to feel good. So these are things you need to think about. A task that you know with effort, they will get it done. Okay? That's industry versus inferiority. Now, Piaget is all about thinking and figuring things out, right? We know the younger kids need to see it, and then they build upon that. We know that they get older, they're, starting to figure things out, putting 2 and 2 together and getting 4, okay? They know that previous experiences, things, this is what they've built upon, right? Now, they're starting to think about why they use this word, I don't know, masters of conservation. And this just means this. You have 10 coins and you have them lined up 5 and 5, it's 10. But if you mix them up and they're all over the place, there's still 10 coins. A younger kid might have to count them again because they don't get that relationship. Or take a tall, thin cup, put some milk in it. Have a short, fat cup. Take that short, fat cup, put it in the tall one, or have them both together. Ask a school-age children which one they want. It doesn't matter. It's the same, right? A younger kid would say, I want the tall one. It's bigger. It's like, I want to have the nickel, and daddy has a dime, and daddy says that dime is bigger than the nickel. They don't understand it because the size is different. The dime is smaller, the nickel's bigger. They think it's more. So when we get to school age, they know that now. They're understanding it, okay? And they know how to put different things together to make them like things. And that's called classification, whether it's all shells, whether it's all, Paw Patrol stuff, or whether it's all Superman stuff. They know that that's the same type of thing. This is what I just said, all about the different putting things here and there, having a big piece of clay and then smushing it on the ground. Same thing. We know it's the same amount no matter what way you place it. Now, Kohlberg. Kohlberg is that right and wrong and a consequence for each. That's what I told you about the younger kids, okay? Well, Kohlberg, as they get older, what they're trying to do is they trying to be a pleaser. They want to please, right? It's a reward and punishment type thing. They know if they're doing right, they know they're going to be good. And they're trying to please as they're doing their morality, their moral, what's the right and wrong of things. They're trying to please whoever is the person who gave them that something to judge. Spiritual development continues to go on, but again, it's in concrete, which means they need to see it, hear it. They need to be a part of it, whether it's a part of, a Christmas pageant, understanding, the manger and Jesus, or if another religion, they've seen it, they know it, they've been a part of it. Concrete, they've seen it, okay? They've heard it, they've been a part of it, they know it. Children want to know who the God is. Now remember, God has a different context for many different people. It's that person who's almightier than you, okay? I call it God. You may call it whoever you like. That is your religion, and that's okay. I don't have to understand your religion. I just have to let you take a part of your religion, okay? So it's nothing with me. It's just me giving you the opportunity to express yourself. Children do expect to be punished for behaviors. Now, I want to give you a great example about this. Now, I worked in the ER the last 10 years of my career, and I seen many kids come in with appendicitis. And these little children, like those 6, 8, 9-year-olds, that's like a great age for appendicitis. I mean, a lot of kids at that age. I'm not saying that's all, but it's quite a quantity that I saw. So knowing that children expect punishment, they think that having an appendix needs to come out is a punishment, because they hit their sister yesterday, or they didn't help mom take the groceries in, or they did something they're not supposed to. I mean, as simple as that, they think they need to be punished. So what do? When I ever have a school age child who's going for, appendix surgery, I would tell them, I sit down and say, listen, you didn't do nothing wrong for this to happen. Sometimes that little piece of tissue just doesn't want to be there and it says, take me out. And I says, and the other thing I want to tell you is that when the doctor puts everything back where it needs to go, I'll make sure he puts an extra stitch so your insides won't fall out. These are things school age children believe. You would believe that those shoulders that are up and tight and scared, all of a sudden you're going to watch that child relax and will go to surgery and feel better about it. Okay. Now, social development. Kids are getting together now. They are in sports, they're in brownies, Cub Scouts, all different groups, right? This is just part of being a kid and growing up, and whether it's judo or taekwondo or ballet or gymnastics, they're getting these groups together. We know that there are children who get their peers, right? Their same-sex peers, and they like a different type of after school activity. You might see some children change their interest because of their friend. They might be playing soccer, and let's say their friend wants them to play baseball, they would change because they want to be next to their friend, because their same-sex peers are extremely a strong influence to them. Okay, those clubs, those organizations, all that stuff are great. They love competition, they like being a part of something, but be very careful. There's always a bully, always a bully in them, making them feel less than. So parents need to still be watching closely, finding out what's going on so that they're not bullied in these sort of groups, okay? Because it does happen. Let's say in sports, you strike out and it lost the game. Guess what's going to happen? That kid's going to get bullied. And they should be reminded, but they caught that ball that shouldn't have gone and they saved an out because of whatever, but they don't remember those things. So again, parents need to be there. What all of these groups are doing is giving that child the ability to separate a little bit from parents, learning from other people, teaching them, other coaches, right? Other kids, other cultures, teaching them. So again, we're starting to break away from mom now and getting a little bit more independence. And still, parents still need to be parents. They do not need to be their child's friend. They still need to be the guidance there. And that sometimes something that we try to be is their friend, and we shouldn't be like that. Yes, we can have fun with them, but not a friend, right? Still keep them in line. Play will always be a part of life. As I said, I don't care if you're, a young toddler or you're an older person, there's still fun that you do, whether it's playing games, whether it is swimming, whether it's walking, it's playing, painting, cooking. All of these things are play for older people. I mean, children, all of those things can be too. Play has rules and rituals. There are something that you have to follow to win in the end, right? Cooperative play. This is all school age children. And it is good because what do you do when you get out in the world? There are rules that you've got to do in order to function and to fit in and to get ahead. So it's what we're teaching them. It's team play or it's alone play, and that mastery, trying to make yourself feel good at something, whether it's cooking, reading, smart, sports, playing a piano. So developing a self-concept. So children are starting to learn who and what they can do and be. Now they're also looking at their appearance. It is important that they have those sneakers that other kids have, right? It's important that their hair is done. It's important, all of these things, right? So it's that they know their abilities, their values, their appearance. other kids, other adults, whether it's in school, whether it's in the band, whether it's in the art room or in any of these, anywhere, they're all influencing your children. Whether you realize it or not, these are adults in the world that are guiding your child to do something. So these people are very important for it. And they do need that positive, good feeling about themselves. Again, a sense of industry. You have a good sense of industry, it means I do this really well. I feel good about myself. And that really helps me to be a happier kid. Body image, again, they're starting actually to see kids and differences as they grow older. I mean, when they're younger, they start to see some girl, boy, right? Well, now it's starting to getting in. Oh, they have glasses. They have braces. Oh, they've got freckles. Oh, pretty blue eyes, curly hair, straight hair, short hair, skinny, tall, fat, whatever. They're starting to see all of these things. And they know that their body, they compare it to other kids now. They're starting to see, am I too skinny? Am I too fat? Do I have too many freckles? And they're starting to see those differences. And, things like hearing visual defects, these children need to embrace them. They don't need to be taken away from their body image. So if they can't hear or they can't, they need glasses, maybe you talk about something else that they do well. They are good at the piano, they're good at cooking, or wow, they got the best curly hair ever, whatever it is. So when you go into school as a kid, you have preschool. It's more fun. They learn, yes. But remember, now you're getting into real school, and now they're into sitting down and structure. And they've got to follow the rules of where they are, the school and the teacher. It's important that they learn how to do this because remember, what do they do when they get out of the house? They got to conform. So it starts in school right now. And having a friend, a peer, again, same sex peer, they talk to each other, what's going on and how they feel about it, and seeing somebody else's opinion. They're starting to see someone else's besides the family themselves. Nutrition, 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 nutrition. This is for life. Um, we know that the quality of the diet and what they eat is going to affect them. You've got good nutrition, their body is alert, your mind is fresh, and they can learn better, right? We know school age children are a great age of children to teach. I've seen them dare to keep kids off drugs. It's always school age, that level. Or kids learning all about obesity. And this is a big thing today. There are many neighborhoods that can't go out and run around in, so they stay inside. And what do? They play games, play videos, and they eat. They're not moving, and you're going to see, because of this, bigger children. And obesity has become an epidemic in this country, whether it's from just sitting and playing games or not having a place to go. So what do? We teach them. We teach them things that they should eat. Their fast foods, they love McDonald's, Burger King, whatever. They need to know that's a treat and not an everyday affair. And it's hard for parents today because two parents working, how do you feed them? Sometimes it is running through and getting a burger. It's all you can do. But the children needs to know about choices there. And then there's something on the internet called My Plate and shows all the food groups and how they should be eating. Now, as I said, obesity is epidemic proportions because of technology. What the major point of this slide is that overweight children, school-age children, will have an increased risk for medical conditions as they get older: hypertension, diabetes, high cholesterol. And that's because they call it these cardiometabolic changes. That means they are getting all of this fat and extra weight on them, and it is going to affect them as they're older. So when do we hit these kids with this information? Young, school age. They can understand and hopefully make some changes at least. So We know nutrition starts as an infant, but it starts with the pregnancy. So we need to be teaching our pregnant parents, our mothers, how to eat properly, okay? It doesn't matter ethnic groups, it doesn't matter anything. All children from all levels of life are all can be affected by obesity, okay? So you don't just say it's this group or that group, it's everybody. One of the things that came out is school age children. Sometimes they sit down to eat and parents make them finish their meals, right? You can't get up until you finish every last bite. That was me growing up. I had 6 brothers. I had 7 kids in the family, me and 6 brothers. And you would sit there and eat until you didn't eat anymore. And what that can do, it could make you for life always finish your plate, even when you were full, because your parents made you feel guilty, right? To finish the whole thing. So remember, parents forcing them to finish everything it shouldn't be. Just say, well, you're not getting dessert then. And don't ask for a snack later, whatever it takes. But don't make them finish everything. Sleeping, they don't need as much sleep as toddlers or preschool, but it's still 9 to 11 hours a day. We know the younger kids are going to fight you and have every excuse not to lay down. But as you get up to that 12 years old, they're tired. I'm going to bed. Good night, right? There's no problem. So depending on the age, remember school age is 6 to 12. As I said, sports, any groups, there are going to be issues and problems with it. Remember, in sports, even though the kid looks big, doesn't mean that they're mature with it. My little grandson, who is 145 pounds and whatever at 9 years old, he plays football and he is a all-state tackle for the state of Florida and the young kids. But he can handle that. He has parents who support him and talk to him about it. But again, it can be the wrong thing for some kids. We know children love to win. They, from the very beginning, don't want you to win a game that you're playing with them, right? They want to say, I won, I won. Well, that's part of sports too. They can't always win. Dental health, really important. One of the things about dental health is they should be flossing at this point. They should be brushing their teeth minimum morning and night, and they should be flossing. Remember, young kids, younger than the age of first grade and lower, so 6 years old, they don't have that dexterity yet to use floss yet. So it's something parents might have to help them with, okay? We know that kids will be getting their permanent teeth now. And I can't tell you how many children came in, they were getting out of the pool, they slipped, their mouth came down, and a front tooth popped out. It happens. So, what would we do? The whole tooth, the whole root, everything popped out. So, and it's the permanent tooth. Can you imagine trying to put a post in a tooth, and the expense could be horrible, right? Well, you can actually take them to a pediatric dentist or a pediatric hospital. They numb the area and they bring dentists in, pediatric dentists, and they can put that tooth back in there. You must put that tooth in cold milk. Why cold milk? Maybe the calcium in the milk cold so it doesn't expand, so it doesn't, breed infection. I don't know. But I've seen many of them take and they just follow up with a dentist and eat a soft diet when they're done putting it in. And the kids actually tolerate it well. We know that they're always curious about sex. You have a penis and I have a vagina and I don't understand. And there's exploration going on. We know that. Now, it is a good time to talk to them about what do they know about it. Now, it's not that you teach them a male and a female and what they do and have a baby. No, you don't have to go into details, but it needs to be started that talk about sex education. And it's not for you to just talk. That child needs to tell you what they know. And then you need to explain what is right, what is wrong, and then, of course, how to be safe. And of course, you shouldn't be doing that, especially in school age. But I've seen young children have babies at ages 9 and 10, and they shouldn't have, but I have seen it for that. So, really needs open, good communication with parents. I'm going to take it one step further. Many parents, mine, wouldn't talk to me about stuff like that. School nurses are a good person to do that. And you see them having these little instructions on, menstruation, right? As they get older, so that they're not afraid. It should be part of the school programs. So, school nurse programs, again, answering any questions, and also talking the difference. What is sex and what sexuality? Being a girl, being a boy, and then sex is the touching, the feeling. Again, encouraging them to talk to their parents, but I would never. So, school nurse, I think it's a great, great job for many nurses, especially those of you with younger kids, because you're on the same schedule as your child, right? So you'll be off those weeks in summer if you want the summer off. And you also have that Christmas break and Thanksgiving break. All those things you'll be with your child, and you don't have to worry about daycare or camp or whatever, right? And it's something that when COVID came about, it became a really huge responsibility because they had to figure out what to do for the kids, how to keep the children safe. So many times we'll get kids before COVID. Let's say we get a kid in with bacterial meningitis. That kid, we will notify the school. The school nurse will send out that piece of paper. Your child may have been exposed to, you need to go to your doctor and get prophylactic treatment. And it could be one pill of antibiotic, but that might prevent bacterial meningitis on another child because bacterial meningitis is bad. Injury prevention. You'll always see on exams, HESIs and NCLEX, all about safety, injury, infection control. They're always there. So when we're talking about school age children, of course, it's always motor vehicles, okay? Where do they sit in the car? They shouldn't be in the front seat until they're 13 years old. When I think about this, I know my kids, when I got divorced from their father, they were 9 and 11, and they used to call shotgun who was going to be in the front seat. Come to find out, they should be in the back seat till they're 13. So it was not a lot of information, that many years ago. I mean, my son just turned 40, so it's a few years ago now. They should still be in a booster seat till about 8 years old. It helps them sit there, lifts them up a little bit. They can see outside, right? Keep them safe. And other things school age kids love to get into is skating and skateboards and scooters and ATVs, right? Well, the problem with ATVs, they should not be in them till they're 16 years old alone. They're not mature enough to be able to handle being away because ATVs are those little things that you go off into the wilderness, and what happens if something you get stuck somewhere? As younger than 16, they won't be able to think, okay? Trampolines, I never wanted one in my house, and it's the highest injury for children ages 5 to 14. I had one in my backyard for years. I was waiting for some big screaming and yelling going on, but fortunately he didn't. But they're not recommended at all. There are trampoline parks now that are safer, right? So parents, we think about kids and what to do for kids, but what about the parent who's having a hard time letting go? And I think that's the hardest for some of them. Let them have that independence. It's like the toddler where the mother says, "Oh, stop, don't do that. Oh, be careful," and holding them back. Well, it's the same thing in school age. You need to allow them to have independence to follow the rules. They need to be clear what you want and when you want and how to do it. Okay. And if they don't do it right, explain what they could have done better, right? and they need to be watching, not sitting there just staring down their backs, but to let them go and do what they need to do. But if they're telling me they're going to someone's house, I might just take in the car, drive by, right? That's unobtrusively. So they're going away from just you, mom, dad, grandma, grandpa, aunts, uncles, friends, and now they're going into, Mary's family or Joe's family and learning who they are and what they're all about. And it could be different religions, different cultures. And again, they're expanding their world beyond just what they've learned at home. ADHD is a huge thing in children. The big thing about it is this hyperactivity that goes on, inability to finish one thing before going to the next. Kids are like that normally, but these kids are even more. They can't sit, they're usually disruptive in class because they can't sit, they can't finish things. And these children, many times, the teacher will send them to the school nurse again, and then the school nurse can talk to the child, see what's going on, call in a meeting with the parents and find out. First, listen. Some parents have done everything, but the kid doesn't do what they're supposed to do. Or maybe there's one more step they haven't done that they didn't know about in order to get their child some care for this. Never assume that the parents have done nothing. Listen first. Find out what they've done to help their child, and then together make a plan so that they can get whatever they need. I mean, my oldest grandson is big time ADHD, and his parents have him in all sorts of therapies. So this is real. This is something that needs to be addressed as early of an age as possible. So, a child has a knocked out tooth, or a VULS is the other word. The parents are reluctant to try to implant the tooth. Where should the tooth be placed for transport to the dentist? Anybody? You can take a guess.
In cold
It's
milk.
okay.
And
It
a
is.
glass of milk.
Could it be a milk?
It is cold milk. Yes, absolutely. And I've had students again ask me why, and something, I'm not really sure. Again,
Is it the calcium?
it could be the calcium or the coldness. I'm not sure. Or maybe it's an isotonic solution. I don't know. The fat in it, I don't know. But that is recommended. And you're going to see them hours later, sometimes before they get the tooth put in, and that root is still nice and healthy. So it does work. I've watched it. All right, adolescents. I call this group of children to the parents. Hold on, it is a roller coaster ride, and don't let go. They are all over the place, right? So this starts, you're a kid, and all of a sudden now you're going to be an adult. And this mind is changing. It is rapid physical, cognitive, social, and emotional maturation. They are 12-year-old as a kid, and now at 13, they're becoming an adult. Remember what goes on at that age, too. Isn't that start of puberty and the start of menstruation? And this is the start of the pre-adolescent growth spurts where they get big, big, big. We know you see all those external things going on, right? Where their voice, they're getting hair, they're getting breasts, their testicles are getting enlarged. All of these things are going on. That's the secondary things. The primary sex stuff, the organs is for having babies. Now, boys, according to Tanner's, and you need to know Tanner, it's the first pubescent change is testicular enlargement. And girls, it's breast buds. And then it goes down to starting with nothing, ending up with everything, is what I call it with Tanner's. As I said, at this age, the beginning of adolescence, why it's so confusing and why there's a lot of trouble here. They go through 20 to 25% of their height is achieved during this time. Within 2 to 3 years, 25% of their height is starting. So they've gone from these little tiny little kids, and all of a sudden they're growing up, they're getting hair, they're getting breasts, they're getting curves, they're changing so much. So, and then just trying to feed these kids with all of this hormone going on. So it's a hard time for physical and mental growth. Now, Erickson, this is all about what's going on, and it also has to do with other kids and the way they're feeling. They're looking for a sense of identity. What does that mean? Well, let's put it, my identity. Well, we know that this is adolescence, so they're getting more sexual, according to Freud, right? So do I like girls? Do I like boys? Or do I like both? That's part of your identity. Number two, am I going to be that nerd in school, the band geek, the art freak, the sports person? Am I going to be the rock and roll kid or whatever other groups out there, right? You have to fit identity, those peers, those same-sex peers. Now, they're very, very, very important now. And then you're felt with, what am I going to be when I grow up? Because now you've got to start thinking about school and getting the grades to go to the college or whatever your goal is to be, right? And again, remember, emotionally, they're all over the place. Remember, hormone. They really are all over. So they're social, again. This is a time where peers are more important than parents, okay? So you're moving away from the parents into another group. Because again, what do you do when you move out of the house, go to college, and move out and get your own place? You got to function, right? So at this time, they're going into those groups, and they're really not interested in having the parents telling them what and how to do it. It is a part of much ambivalence. They don't know, they don't understand, they're trying real hard. And I call this intense sociability, intense loneliness. I'll give you an example. So let's say you have a best friend, right? That's your peer, your best friend. And that best friend knows that you like that guy over there. And all of a sudden you go to school, walk down the hall, and there is your friend hugging up on the guy that you wanted to be with. You've lost your best friend and the guy. This is when, oh my God, and this is where they go off on their own and get depressed. What did I do wrong? I'm not good enough. Loneliness. And again, it started out with being with a friend and these people in school and going there and there or whatever. And then it's, I'm so bad. I don't feel good. I'm so unhappy. And depressions can occur. Acceptance by peers. Peers are very important. And as I said, in those peer groups. Parents. Well, parents now still need to be parents. They need to be there. They need to be there to catch the child. Okay? They need to still maintain the rules. And it is the most frustrating thing that ever happens. Because teenagers, they struggle between privileges and responsibility. It's that turmoil and ambiguity. I mean, it says it all. But these children, privileges need to be earned. That means they put their clothes away, they make their bed, they, bathe when they should be, they take the garbage out, they're good at school, they bring home good grades, they come home when they're supposed to come home, they communicate. These are those responsibilities that parents need to communicate to their children so that these children will get privileges. The hardest time of this happens about ages 15 to 17. We're over that pre-adolescent growth spurt. Most of the hormones, we're getting used to them. We're pretty settled with it. And again, this is where, again, they go over independence with responsibilities. And this is something that you'll see a lot of kids doing whatever they want, coming home late, they don't care. And it's not unusual. So what would be a good thing to recommend as a nurse to these? Well, you've got two things. Well, you got a school nurse, right? Always have a school nurse to fall back on. But having a parent sit down with a child and compromise and work together and make a plan that's not unreasonable for either side, sometimes that will work. Sometimes you're talking to, they're not listening, but at least trying it. I know as a single parent with a 17 and 15-year-old boy and girl, they were 17 months apart, it was hard. I had to hold on to the roller coaster ride. So we know they have parents for their everything, and now they're more of a, you're trying to tell me what to do, right? So it is a struggle. Again, we know that there are times where you have that emancipated minor. Sometimes it happens for many other reasons. And that, again, will feed into their signing their own consents and whatnot in HIPAA, right? So relationships with the peers are very important. That gives them that feeling of belonging and need and that strength and power and unity. And I feel good because my buddies and them, we all like the same things and do the same stuff. Another thing is usually an adolescent has a best friend. Hopefully they're not going to go after your guy or your girl, but best friends, what you see in that relationship between your best friend as a high school person, that adolescent area, is probably how you're going to treat your partner for life. And it's been researched that way. So, how do you talk to an adolescent as a nurse? Now, they don't want to talk to nobody. They know everything. They don't want to go to the doctor. They don't want to do this. They don't want to do that. They've got their earphones in and listening to their music. And how you, as a nurse, going to get through to them? Well, number one, I would ask nicely, could you just take your earphones out? And then I would say, so what would you like me to call you? What is your name? And that is going to go through either that girl who dresses more masculine or that boy who dresses more feminine. You know, at this time, they're starting to experiment with who they are, right? So if you identify that to say, so what would you like me to call you? Number one, for a normal kid, a kid that's not going, not normal, but a kid who's not going through that, it wouldn't be offensive. And the kid who is, they go, oh, this nurse really cares. Okay, I've been given some recognition. And that's what adolescents, right? Now, there is a time where diagnoses, for instance, urinary tract infections in young girls and adolescents, and this is their second, third one in, a year. This would be something where you would have the parents walk out of the room and say, so how do you think you're getting that urinary tract infection? And again, these children, adults, adolescents, whatever you want to think they are going to tell you some things. Don't look offended. Don't look surprised, because they will want to do that. They love shock value. So they could say, yeah, well, we don't have sex, but we have anal sex. And you're like, okay. These are things I've heard as a nurse. And what that does is you're finding out that maybe they need to, immediately after they have their intercourse, that there's certain cleaning that needs to be done. Or maybe you should tell them, that that's probably part of it. One of the other things in the urinary, the GU chapter, is all about after sex, to prevent urinary tract infections, they should urinate immediately after sex, and that can help it too. So again, if this adolescent's having these things and these issues, and they're telling you they're uncomfortable speaking with their parents, again, school health nurse, right? We know adolescents are going to be getting that HPV vaccine. We know it's boys and girls, right? And it's something that they get. It's a 3-dose thing that they do. Nutrition. Now, remember, adolescents are all worried about too skinny, too fat, too many pimples, whatever. So they're really worried about what they put in there themselves. Many of them will take some sort of power bar and a bottle of water, walk out the door. And they're so busy, there's nothing they can do. And then they come home and eat dinner, if you're lucky, right? So they're not getting proper nutrition. So making sure that we do frequent checkups for those kids, at least a minimum of once a year, because maybe they're not getting enough iron. Maybe they're iron deficient anemia because of the way that they're eating. Sometimes they're eating all the time, just little snacks and not real food. Again, that might be an overweight teenager, adolescent. Again, 24-hour food diaries really do help. Now, I told you in the beginning of adolescence, they have this 2 to 3 year period of growing up to 25% of their height and weight, right? Now, they should get sleep through that. They don't. Why? Well, they're on the phone, they're on their games, they're texting their newly found girlfriend, boyfriend, and they're not sleeping the way that they should. And then you've got there's a project for school I got to get done. I have to go to the basketball game, the football game. I have to do this and that. There's no time for sleep. And those are the reasons why they don't get sleep, but they should. Again, they should have some sort of exercise. Some of these kids just walking the way that they do their houses, between their friends' houses, whatever. Usually, that will be good enough, but making sure they're not dormant, just sitting on a couch. And of course, always dental health, permanent teeth, making sure they're brushing and flossing. We know a lot of sex is on TV today. I was just talking to my husband about Lucille Ball. They had a show where they showed the bedroom with two twin beds. The immediate outburst of like disgust was amazing. Well, I watched a TV show last night and they're in bed naked. I mean, there's a lot of difference that is going on with TV. And remember, that can influence them. And it sort of makes that sex is okay at any age. So it's just something parents, again, should talk to them. But again, if not, who do we have? Well, we have school nurses. And hopefully, we still have Planned Parenthood out there. It's always a good opportunity for adolescents to get some sort of birth control or talk to someone about things that's going on with their bodies that they don't want to talk to with anybody else. So that could. Safety injury prevention, well, motor vehicles, but something, not only motor vehicles, they're driving now. So they're in the car, they're ran over by cars, they're hanging on the outside of cars. These are adolescents. Again, they think they can pick up firearms, dad's firearm. Yeah, okay, I'm old enough now. And it goes off. That's how things happen. Sports injuries, they get up, go, they forget to warm up, or they don't put on the proper equipment. They don't have time. And again, injuries. So preventing injuries is something that starts with everybody. So Matt, he's 14 years old, seems to always be eating. Remember the age, that's the pre-adolescent growth spurt time, right? Although his weight is appropriate for his height, the best explanation for this is why. Should he be always eating? Remember, he's gone 25% up. He's needed to fuel that growth. It's absolutely normal. He's getting taller. He needs to fill in what he's doing there. So, any questions? Who wants to win the Kahoot today? All right, Christina does. Ellen does. I know you do. Jose, you going to win? All right. Annette, I know you. You're very competitive. Kirk, well, look at you. You're serious. All right, I got you. Let's go ahead and let's get the Kahoots. And we should be just about where I told you in time. All right, let's get started. Week 3, school age and adolescent children. How does the onset of pubertal growth spurt compare in girls and boys? Remember I told you girls around this age think boys are stupid. Why? Or they're silly, they're dumb, they're childish. So girls, it's 2 years before boys. Very good. A multi. What activities are appropriate for a 6-year-old child? Remember, this is the beginning of school age, and they're not going to be able to do what an 8-year-old or a 12-year-old kid can do. So what is good for them? And 6-year-old is just after preschool, so they're still young. So they can ride a bike, they can jump the rope. Organized sports are iffy at this time. Can they handle the pressures of the sports? Follow the instructions, or are they mature enough physically to do it? So that's why not that. And card games, that is too old for them. So you didn't do that one. Good. At what age should a parent expect to have major conflicts over independence and control with their child? Told you, this is the roughest age of adolescence. And that's 15 to 17. Right there after the growth, they're grown up, they're taller, they're becoming young men, young women. This is when I want to do what I want to do. And it's hard. Signs of the onset of puberty in girls is first sign. Now, on your study guide, you have a Tanner's sheet there, and it shows you what it looks like. There's 4 or 5 different stages of puberty, okay? Something I would look at. You're not going to have to know stages, but I know in HESI, they were looking for stages, and I know NCLEX does, so just become aware of it. Yes, it's breast buds in girls. The onset of puberty in boys is characterized by so boys is testicular enlargement. Now, all the other stuff happens, okay? But physically, testicular enlargement. What do you use to determine if a female has reached the age of menarche? What have I been telling you about that shows you all about this? They entered puberty, changes you see, and then they have menarche, usually 2 years after the beginning of puberty. And that's Tanner's. It is just Tanner's is scientists who made these stages, showing the development of puberty in girls and boys. A child goes to the ER with a low fever, pruritic rashes, and open oozing papules. Nursing care includes. This is not unusual to be in an ER and seeing a kid that looks like this little rash, and it's oozy, and there's different stages of healing, and they have a fever, and you always need to protect yourself first and everybody else. And that would be, it's probably varicella, chickenpox. Put a mask on because it is airborne. All right. The other thing, these children must have their mask put on and immediately put into this negative pressure room. What that means is the air from the room goes outside. It doesn't go in the ventilation system. It is usually, there's one room on every unit in a hospital that has that. And there's usually 1 or 2 rooms in an ER that have that too, protecting other people and yourself. The source of injury, whether intentional or unintentional in adolescence, is associated with what? What did I tell you? Injury for all age everybody's. And that's motor vehicles, whether they're in it, sitting as a passenger, driving, or on top, riding on the outside in a parking lot, having fun with his buddies in them, right? These are things. Motor vehicles are a big source of injury in adolescence. If a parent feels uncomfortable talking about sex education, who's a good resource? It's the school nurse. Talk to the older siblings, they could give you bad information or inaccurate, okay? But school nurse is better. Parents are always the best. School nurse is second. A 9-year-old friends tell him soccer is a dumb game and he should play baseball. Why is he saying that? This has to do with Erickson and same-sex peers. And it's important that this buddy, his friend, accepts him the way he is. And if he has to change his sport, he'll change his sport just to be accepted. They're very influential in school age. During admission, the father of his 16-year-old says, "We are Buddhist. Culturally competent care includes what?" When you work in multicultural areas, you're going to get a bunch of different cultures and religions. And it's not for you to know what they all are. You know what you do? You ask the child, he's 16, or you ask the parent, "So, what do I need to know, and how would that change your care?" It could mean if it's a girl, they don't want a male nurse, or it could be food, dietary. So just ask. I'm telling you, parents will be very happy and pleased if you just ask. It shows that you care. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So if you're giving sex education, you should just give them information, talk to them about it, and give them something in written form. You can't give your opinion, okay? What you need to do is if they ask a question about condoms or they give you a question about birth control, you can give them information, but oral and written form is what they do need, okay? A multi. The management of adolescent obesity should include, so they're a teenager and they're overweight and they need help. How are you going to help them? So, of course, that diary is important. And incorporating some of their favorite foods. Absolutely. You can't just take everything away, right? Diversion is for younger kids. And using nutritious food as a method of reward. "Oh, here's some carrots. You've been good." It's not going to work. So it isn't that nutritious foods. Infants go through a predictable sequence of growth and development. This is called. You will always see me go backwards in the cahoots, asking some concepts that you need to understand. And you will see them here. Infants. and it is sequential trends. It's like, no, it can't be there. It's the same word, right? But it is. There's certain sequence children go through, and it is called sequential trends. Which benchmark serves as the ending period for school-age children? So we know that when they're 6, they have all their baby teeth, they lose them, and they get all of their, permanent teeth. And it's the onset of puberty, which starts at age 10 or 12. That's the ending of school-age children. What action would improve dental health in the school-age child? So flossing always improves it, and always remember it is said that a first grader, 6-year-old children really don't have the dexterity to do that big string thing. They can't do it yet. So it would be the older children. Today I thank God they got those little things, a little stick. You can use them easier instead of using the string. But flossing always will improve dental health. Generally, the earliest age at which puberty begins is it's 10 girls and 12 and boys. Very good. Remember, girls before boys. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Is that normal for an 8-year-old to think? It's an absolute belief in there. Remember, I talked about that appendix and telling that child it wasn't because they hit the sister or didn't do well on an exam. It's not that they did anything bad. It's just something that just happens. Same thing here. This child, it's a school-age child, feels she's being punished for doing something wrong. It's a common belief, absolutely. A 6-year-old needs to get a chest x-ray. What explanation is the best? I don't know if you ever had an x-ray. They have the machine on top of you, or they click it over and they stick it up next to you, and you're hugging things, and it can be very scary for a young kid. We know that the best thing is to make it into fun, into play. You're going to take a picture. We're going to look at your insides. And then I had the ability, thank goodness, in hospital where I worked, that they had x-ray screens in every room, and I could pull it up from the computer. And these kids could see what their insides looked like, and they just loved it. How do you get an adolescent to open up about their sexual history? So again, any kid you come into, you've got to open up a dialogue. What is that dialogue? What are you going to talk about? What music you're listening to? Where did you get those sneakers? I love them. Or what do you do for fun? What type of music are you listening to? What do you do in school? What do you want to be when you grow up? All of those things are part of opening up and getting into making them feel comfortable with you. Then you'll get more information out of them because now they think, oh, she's pretty cool. All right, I could talk to her. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? Well, you've already done the thing about opening them up and having them feel comfortable about you. That's always your number one. You can't walk in and ask direct questions immediately. It's not going to happen. But you're going to open them up first, then have the parents leave the room. Once the parents leave the room, be prepared. They're going to shock you. Don't act shocked, but sit there and listen. Be understanding. That's all an adolescent wants. Somebody to listen to them. A multi. When educating adolescents about the risk for HIV and hepatitis, what would you include? I mean, these are real. So they need more than a weekly shower, okay? That would be number one. Remember, they're full of grease and oil and they're sweating. It's just part of their hormonal thing. So at least a shower every day. Abstinence, of course you can say it. They may not listen, but condoms and always hand washing always works, okay? You don't know where the hands have been. Think about it. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? I like that little boy with his front teeth out in that picture. That is a typical 6-year-old child. Put it in cold milk, and again, they can implant it. And I know where I worked, we would call the dentist. It might take an hour for them to get in there, but we put numbing cream on whatever tooth's going to go back in. They're going to come in, it's nice and numb. They can put it up, and you'll feel like wiggling, but it doesn't hurt. They just feel the pressure of, him putting that tooth up in there. A nurse planning care for a school-age child should know which thought process is seen. School-age children. So school age is that ability to conserve. Remember that word? I'm like, what does that mean, conserve? That's the glass tall, the glass short, the big thing of clay, the smush clay. It's still the same amount. That is called conserve. Animism is taking a broom and making it into a horsey, putting their arms out, making it into something. Magical thinking, preschoolers. And thoughts are all powerful. That's not in this. I don't think many kids do that. What stage of Erickson would you use for a school-age child? Remember I told you this is one you have to know. School-age children. Infants, it's trust versus mistrust, right? That's the other one that's used a lot. The second one, school-age children and the adolescents. Industry. What can I do good and feel about? And what I can't, I feel inferior. So I know the word, it doesn't make sense. I don't know what to give you to remember it by. Is it like a jingle lingle? But industry, what do I do great and feel good about? School-age children's moral development. So the younger kids is doing right or wrong based on consequence. In school age, they know morality, right and wrong, but they like to do right. They conform to rules because they want to please. They want to get the praise for pleasing, okay? Fear of punishment, that's younger. Conform to rules, school age. Multi-select. Anorexia nervosa is characterized by. Now, I didn't go into eating disorders on the slide. there are two sort of eating disorders. And I have about 3 slides to go over that concept with you. What is anorexia nervosa? We know that picture shows it really well. And it's a fear of weight gain. Anorexia nervosa, they don't put food in their mouth. It's a piece of lettuce and water. Vomiting and purging is bulimia. What is the difference? Well, bulimia, you eat, you like unbelievable amounts of food and you vomit it. You would see rotten teeth from the stomach acid from bulimia. So they're both could be just as skinny as that picture, but the bulimic wouldn't have good teeth because of the amount of stomach acid coming up and burning the teeth. The anorexia would be skinny. It would then beautiful teeth. How do you know if you suffer from bulimia? Again, binge eating and purging. I mean, they can eat a whole refrigerator full. You eat it and throw it up. Eat some more, throw it up. And then, of course, they feel bad afterwards, et cetera, et cetera. But it is a disease and it needs treated. Adolescents are what? So they're somewhere between being a kid and being an adult. And again, it's the most troublesome, confusing time of their lives because they have to figure it out, don't they? What is an adolescent's heart rate? We talked about an infant. Well, what is an adolescent? Do we know that an adult, 60 to 100, right? That's an older adult. When you're an adolescent, it's slightly lower than. Their hearts are beating more efficiently. They haven't done enough yet to damage it. So 55 to 90 would be what it is. As we get older, we drink, we smoke, whatever, and that damages the heart. We don't do exercise, so it's a bigger heart rate. Adolescents, they haven't done that yet, so it's slightly lower. When talking with an adolescent regarding personal health concerns, which is most important? Parents left the room, you're in there talking with them. What should you remember? Yes, give them the opportunity to express their feelings openly and honestly. And as I said, be prepared to be shocked. They love to do it. I'm like, oh, okay. They couldn't do it to me. A parent says their infant puts everything in their mouth based on Freud's theory. You would respond what? Again, another question from last week. What do we know about infants and their mouth? They explore the world, remember? And it's where they self-soothe, whether with a finger, a toy, or a pacifier. They decrease their stress by self-soothing, and everything goes in the mouth. They want that, what is the texture? What does it taste like? All of those things are important to an infant, and that's how they explore. I mean, kids up to even school age, they're always chewing on something in their mouth. I'll multi-select. What could be a sign of potential child abuse? I've seen several cases of child abuse in my career, and it's not a thing that you like to see. But remember, in the case of child abuse, it is not for you to be there and push blame on anyone. Your job as a nurse, when you're suspecting child abuse, is to protect the child. I had one case where I had a 3-month-old infant that the mother was carrying this infant, and behind the ear was this yellow purplish area, and the kid was very fussy. So the first thing I did was take the child, put a hand behind the neck and the head and underneath the buttocks and put it on the scale, and I felt my thumb go into the head. I went, okay. Well, what had happened is this mother, and it was twins. This mother had to go back to work. The father lost his job, and the mother had to go back to work and work 3, 4 jobs, whatever it was, to support the house. And the father couldn't handle being a father. And literally, the father took the child and smacked the head against the surround in a shower. Would you like me to take it a step further? We called in the twin. The twin had a fractured skull, just like the other one, fractured ribs, fractured humerus, and a fractured femur. Both twins, 3 months old. Would you like me to go further? We called in the 2-year-old boy. He was walking around on a fractured femur and had multiple old fractures healing. Child abuse is real, and I'm the one who caught it. What did I do? I immediately took that child and put him in a place where I could watch. Wasn't blaming anybody. And I wanted to strangle someone. I was so upset. I told the nurse in charge and I told the physician in charge. And then I personally took that kid over for an x-ray of the head. We saw the fracture, and then we did an x-ray of the entire body and found the rest of the stuff. From there on, of course, DCF, police, everything was called. And after admitting these children into the hospital, about 3 days later, we found out it was the father. That father was taken out of the environment, and these children were made safe. So our job, and I came home crying. I was so upset about the whole thing. So our job is not to get upset, not to place judgment. Our child is get that child comfortable and keep it safe, okay? Probably one of the hardest things that I've seen.
You may have saved that child's life.
Probably, yes. Yes, thank you. In addition to injuries, the leading causes of death in adolescents ages 15 to 19 years are what? So remember, this is the age of looking for identity, big ups, big downs, and emotions. And remember, they're into risky behaviors. They think they're big kids now, and it is homicide, suicide. Remember, any kid who gives you any inkling that they want to commit suicide or a friend wants to, take it seriously and make sure they get help, okay? Because it will happen. In the school age conflict of industry versus inferiority, what does industry mean? You know this one. What is industry? What does industry mean? And that's mastering a task. Whether they're good at sports, good at cooking, good at piano, good at spelling, good at math, whatever it is, they can do it well, because the inferiority is everything else they can't do. Mastering a task, whatever their task is. Which age group prefers to be with members of their own sex? Same-sex peers, another way to put it. And that's the school age children, which here is 7 to 11. Same sex peers. As they get to be, excuse me, adolescents, they're not really into same sex. They're just part of the same peer group that they're in, whether it's band or music or whatever. True or false? Home support is invaluable to the adolescent. Do they need home, mom and dad? Do they? Really? Yes, they do. They absolutely need to be there to pick up the pieces when the kid needs it. What if find out that two friends were playing with a gun and one was killed? Doesn't mom and dad have to be there to support that kid, to give him hugs? What if, like the incident with the best girlfriend and the boy, and she took the boy away and she's home alone crying? Doesn't she need mom or dad to be there? Part of it? Yes, they always need that safe place to come home to because they've been safe all the way up to the point where they didn't want them anymore, okay? So yes, they're invaluable. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? It is not anorexia nervosa. Skinny, 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 yeah. And a lot of these things here look like they're hypothyroid if you look at these symptoms. Now, if you have a kid who's lacking food in their diet, they could have dry skin, intolerance to cold, or constipation. But those are 3 signs of hypothyroidism too. But they're not suffering from anorexia nervosa because their teeth are rotting because of the vomiting of bulimia. Good. A 14-year-old in the ED, emergency room, after a biking accident. How should the nurse interact with this adolescent? Now, I worked trauma a lot, and I was primary to many kids who came in, off the copter, bring them down, put them in the room, and everybody's running at once. You're going to have x-ray there, EKG there. You're going to have surgeons, neurosurgeons, starting IVs. I mean, everything. Well, number one, you need to let them know what's going on, and you need to let them ask questions, and you need to answer it. If they know what's going on, why it's going on, you're literally teaching them, okay, this is a surgeon. He's checking to make sure that your tummy's okay, that you haven't broken any bones. Here's an x-ray. We're going to look to be sure. Here, we're going to start an IV just in case we need to give you medicine for the pain. You're telling me your leg hurts. And these are things that you're telling them quickly so that they're not going to be screaming, yelling, moving. And if they have a neck injury, they're not going to be moving their neck and creating more paralysis. Cooperative play. Which one's cooperative play? And this is all about a goal. Bunch of kids playing together, there's a goal. Whether it's building a house with Legos, building a sandcastle together, or playing a board game like checkers, or chess. Those have a goal. You have to win. There's a finish. It's not just you just keep playing, okay? Cooperative, there is a goal. Associative, they're just playing and having fun. There is no goal. What does moral development involve? Moral development's all about Kohlberg, the theorist, right? When you're talking about younger kids and moral development, it's literally punishment and reward is what they're looking at, right? They're to be rewarded for good behavior, punished for bad behavior. It's right and wrong and the consequence for either of them. Punishment and reward. Developmental milestones are important to observe because we look at children and what they're doing and what they should be doing, because if they're not doing what they're supposed to do, we can institute early interventions, right? If the kid is 10 months old and they're not sitting yet unsupported, there might be a problem. Or if the kid's not rolling over by 10 months, something's wrong. Or their head doesn't come up when you pull them up, head lag, there's a problem. And what do we need to do? Of course, tell the physician and he'll institute early intervention, speech, physical, or occupational therapy, whatever they need. And you know what the great thing about kids? They catch up really quick. Kids are like sponges. They soak it up and they learn. It's catching it early. Lymph nodes in children with normal findings should look like what? Didn't feel them at all. Children who are sick, you'll feel those lymph nodes. In kids that are healthy, nothing. You feel nothing. Depriving a child of food, clothing, and shelter is called what? I saw one case of abuse where they withheld food on a child, must have been for a month or two. And he came into the ER almost dying, and we had to resusc, and he did make it and was taken away from that family. And that is called neglect. It is neglect, whichever way you call it. So I've actually seen it. Kid had not a piece of fat on anywhere on his body. It was terrible. Which of the following immunizations is given in the adolescent stage? And remember, this is a series that they get. It's boys and girls, and it's the HPV to prevent your cancers. ADHD most likely involves which of the following? The inability to sit down and finish anything, right? Or we could call it inattention, distraction, impulsivity, hyperactivity. Does it difficulties? It may not be. They might be the smartest kid in the world, but they can't sit and finish reading it. Poor motor control, they might be the fastest kid in the world. It's not that. It's all about inattention, distraction, impulsivity, and hyperactivity. A multi. An adolescent has been brought to the ER with a drug overdose. What are some initial questions to ask? The kid came in, so loopy. We had to give, let's say, Narcan out in the field, and they come to us. So they're still a little drowsy, but pretty well awake. What do you need to know? What's number one most important? Well, you need to know, what did they take and when they took it, and was it IV, IMPO? Because the method of delivery depends on how long it's going to stay there. IV is gone quickest, right? And IM would be the next, and then PO. Those are the important things. Do you want rehab? They don't want to talk about rehab as at this point. You need to treat what's going on now and then get them the help that they need. And last question. Adolescents typically place blank on peer relationships. And I'll just say it again. They want nothing to do with mom and dad, do they? It's all about their buddies and them, as I used to tell my children at that age. What are your buddies and them over here again? And I'm like, please, as much as possible, whether you hear them somewhere else. So number 3, Keisha. Good job, Keisha. Number 2, Hyde. Hey, Hyde. Number 1, Hope. Good job, Hope. Number 4, a future RN and Thomas. Good job, guys. So this is for this week. This is your school age and your adolescents. Remember, this week we're doing a bunch of reviews. I'm doing mine tomorrow night at 5 o'clock. Again, you will have it later on that night. I will be posting reviews. Again, I'm going to make one announcement and it'll say Exam 1 reviews. I will continually refresh that announcement to have it in one place, unless you want 7 different announcements. I don't think you do. So I'm going to help you. I'm going to put it in one place. It's going to also have the Kahoots there, and it's going to have the PowerPoint there. So again, it's in one place for you. You have 3 classes, and I know how hard it is to keep up with them. So I don't want to make it more disorganized for you. So that's all I got for today. Anybody else need anything? Well, have a great evening. Good class. See you guys.
Thank you.
Bye.
You're
Thank
very
you.
welcome.
Thank you.